Cervical plexus. The cervical plexus nerve arises from the anterior rami of upper four cervical spinal nerves C1, C2, C3, C4. The cervical plexus lies deep to prevertebral fascia and passes over the scalenus medius muscle. It has motor and sensory branches. The sensory or cutaneous branches of cervical plexus emerges from posterior border of sternocleidomastoid muscle 1 centimeter superior to the emergence of the spinal accessory nerve at a point. That point is called Erb's point. These branches provide sensory innervation to anterior neck with four named branches: lesser occipital nerve, greater auricular nerves, transverse cervical nerve, and supraclavicular nerve. Lesser occipital nerve, it is entirely formed from the C2 root. This branch provides supply to skin posterior to the pinna up to the superior nuchal line. Greater auricular nerve, this branch is formed from the C2 and C3 and runs superiorly from Erb's point across the sternocleidomastoid muscle toward the parotid gland. It branches into anterior and posterior division. The anterior branch supplies sensation to the skin anterior and inferior to the pinna, whereas posterior branch supplies the inferior pinna, including the lobule, the skin inferior to the pinna, and provide innervation to the parotid capsule. The nerve is often injured during neck dissection and parotid surgery and may have to be sacrificed to enable access to these areas, resulting in insensate lobule or numbness of the upper neck and periauricular skin. Transverse cervical nerve, fibers from the C2 and C3 nerve roots combine into a single nerve that leaves upswing, then passes anteriorly in branches multiple times to give sensory innervation to the skin of the entire anterior neck. Supraclavicular nerve, C3 and C4 nerve root fiber combine to form a single nerve which branches after upswing into three main divisions. Median branch supply an area of the skin down to sternoclavicular joint, and intermediate branch supply the anterior chest wall skin down to anterior axial line. The lateral branch supply the skin over the deltoid muscle and as far posterior as the spine of scapula. So three division: median division to sternoclavicular joint, intermediate division to the anterior chest wall, and lateral division to the deltoid muscle. Now, muscular branches are given off segmentally to the prevertebral muscle of longus capitis, longus colli, and scalene muscles. The other muscular branches are superior and inferior root of ansa cervicalis, segmental branches to sternocleidomastoid muscle and trapezius muscle, and nerve which supply the diaphragm is phrenic nerve. First muscular branch, ansa cervicalis. Ansa cervicalis, ansa term comes from Latin word means loop. This nerve is formed from the superior root C1 fiber of descendant hypoglossi and inferior root from the ventral rami of C2 and C3. The two roots merge over the internal jugular vein to form the ansa cervicalis, which supply motor innervation to the infrahyoid muscles, sternothyroid, sternohyoid, thyrohyoid, and omohyoid muscle are supplied by the ansa cervicalis. The second motor supply of cervical plexus segmental branches to the sternocleidomastoid muscle and trapezius. Some fiber are supplied by the C2, C3 to the sternocleidomastoid muscle, C3, C4 to the trapezius muscle. So this is additional supply of these muscle, main supply coming from the spinal accessory nerve. That's why if you injured this spinal accessory nerve during neck dissection, some motor function is still there because of these C2, C3, C4 supply. Last motor branch of cervical plexus is phrenic nerve. The phrenic nerve is most significant motor branch of cervical plexus, formed from ventral rami of C3, C4, C5, which runs inferiorly on the anterior surface of scalenus anterior deep to the prevertebral fascia to provide sole motor supply to the diaphragm. The phrenic nerve is identifiable as the only structure deep to the prevertebral fascia that runs from lateral to medial. In addition to providing motor supply to the diaphragm. It also provides sensory innervation to the central tendon of diaphragm. This is cause of referred pain to the shoulder tip secondary to diaphragmatic irritation from abdominal or chest pathology that is referred by the C4 root of phrenic nerve, which communicate with the C4 root of supraclavicular nerve. So, any pathology which irritates the central tendon, which is originate from C4 root, may refer pain to the supraclavicular region where the C4 root is supplying. The surgical significance of these cervical plexus is the cervical block. You can block the upswing doing any surgery in territory of the cervical plexus. And another importance is greater auricular nerve graft to anastomose any nerve like facial nerve anastomosis.